Mr. Secretary, the American Heart Association had a lot of good things to say about these new recommendations. They like the focus on whole grains, on fruits and vegetables. But when it comes to saturated fats, they say that saturated fats are a primary driver of cardiovascular disease. You said you're ending the war on saturated fats. Where is the evidence that that is a good idea?
Well, the problem is that there's no good evidence that saturated fats drive cardiac disease. That is a dogma that was based on a 1960 study that has been completely debunked.
Actually, every major health association says that they still believe that there's validity there.
Well, again, it's based upon a dogma, but not science. Science comes from scientific studies, peer-reviewed studies, not from experts or orthodoxies. And the study in 1960 and in the late 50s that indicated that there was a slight risk for saturated fats and cardiac disease was not based on good science. We've had years, we have decades of good science now that says protein is important. It is absolutely critical. And today about 50% of the calories that are consumed by children in this country are ultra-processed foods. That's not good. That comes from 40 years of bad advice by the American Heart Association, the American Medical Association, and other associations that put Fruit Loops at the top of the food pyramid. We all know that sugar's not good for you, salt's not good for you, ultra-processed foods, refined carbohydrates are not good for you. Protein is good, real food. Protein, dairy, fruit and vegetables, and then grains, whole grains. That's what Americans should be eating, and that is what the science says, and our study is a science-based report, and all the citations are in it.
There is some conflicting research when it comes to saturated fat. So how did you decide to come down on one side rather than the other, and can you share with us who you relied upon to make these decisions?
Well, those citations are all in the report, just so that you know there is a cap on saturated fats of 10% of the diet. It's pretty low. It's a lot of people thought it should be much, much higher. What we're stressing is that people should be eating protein, not particularly saturated fats, but protein in all of its forms.
There are a lot of doctors who will applaud the focus on discouraging ultra-processed foods, highly processed, packaged foods in the diet. But how do you discourage the food industry from selling those foods, because they are designed to be highly desirable and to promote binge eating?
Well, I mean, our purpose, there's no mandates in the dietary guidelines. They're going to change the food culture in America because they dictate what we sell, what we feed to our military. They dictate what we have in school lunch programs. They dictate on what we're eating, what children are eating in subsidized programs like Head Start, in prisons and other places where the federal government subsidizes the food. But if you're American and you want to eat a donut, you're going to be able to eat a donut. We're not taking food away from people. We're just telling them that's not good for you. That the costs of eating that food are going to be enormous in the long run, and they're going to cost you your health.
I want to ask you about another big decision by the administration this week, the CDC's new vaccine guidelines, which include rolling back recommendations that all kids get vaccinated for flu, rotavirus, and hepatitis A. What is the scientific basis for rolling back recommendations for vaccines that have been proven safe and effective for 50 years?
Again, the science is in the report. What we did is we looked at the scientific evidence, and we looked at the practices, the best practices of our peer nations, the European nations. And what we centered on was the vaccines that are used by everybody, where everybody
Isn't every
agrees.
nation different, though? We're the most advanced nation in the world when it comes to science and medicine.
We also have the sickest population. The countries that have fewer vaccines actually have much healthier populations than us.
Is that because people use vaccines? Where's the evidence for that?
Not necessarily. The vaccines are not sparing them those diseases. So, and all of those countries believe that if you put too many vaccines on the schedule, and vaccines that are unnecessary, to stop common diseases that actually threaten children's health, that it is going to decrease uptake. It decreases the faith of the public in the vaccine schedule. But first of all, people should know we're not taking vaccines away from anybody. If you want to get the vaccine, you can get it. It's going to be fully covered by insurance, just like it was before.
But it is more difficult now for parents to get their children immunized for the flu, right? They can't just go to a pharmacy. They'll have to consult with their doctor first.
You need to do a shared decision making with your physician, which is how it ought to be.
Fewer people will get the flu vaccine.
Well, that may be, and maybe that's a better thing.
Based on what evidence? There were 290 kids who died last year due to the flu. There's no evidence that any kids died or were harmed due to the flu vaccine. So isn't this inevitably going to lead to more children dying?
The Cochrane collaboration, which is kind of one of the ultimate arbiters of vaccine safety and clinical data, has done an extensive meta-review of the flu vaccine. And they found that there is no evidence that the flu vaccine prevents serious disease or that it prevents hospitalizations or death in children. There's no scientific evidence, and what we tried to do is to follow the science.
90% of the kids who died from flu last year were unvaccinated for the flu.
What I'm telling you is that there is no scientific evidence that, according to the Cochrane collaboration, which is the meta-review of all the scientific studies out there, there is no scientific evidence that the flu vaccine prevents serious illness, hospitalizations, or death in children.
Let's talk about very quickly the rotavirus vaccine. Before that vaccine went into use, there were thousands of kids who were hospitalized every year due to gastrointestinal distress from rotavirus. Do you really want to go back to those times?
Well, the rotavirus killed approximately 3 people a year, 3 children a year, and I think since the rotavirus vaccine has come online, has been recommended, that's dropped to around 2 children a year, and you're giving 3 million vaccines. And so to prevent 1 death, you have to give 3 million.
But thousands of hospitalizations, which is serious, right?
Well, if you're giving 3 million vaccines to prevent 1 death, then you have to make sure that the vaccines are not causing any damage. And various rotavirus vaccines have been linked to very, very serious and deadly diseases, including intussusception.
Okay, well, I don't know that that's the scientific consensus about the vaccine.
Well, that is,
but
it was actually
on,
withdrawn because of that.
You've said that you just want to give people more choices, but isn't the whole point of vaccination to establish herd immunity so that people who are healthy don't give these diseases inadvertently to people who have pre-existing conditions? Isn't that why we're seeing more measles cases and whooping cough cases?
We're still recommending the vaccines for whooping cough, for measles, and for other
But as
diseases.
fewer people get them because they have concerns overall about vaccines, some would say unfounded concerns.
The purpose of reducing the schedule is to increase the uptake, not to decrease it. And that is why the Europeans have fewer vaccines, because they believe, based on their evidence, that people are more likely to vaccinate if they trust the schedule, and each vaccine that you add increases the trust to the schedule. The vaccines, for the most part, that have been removed from the recommended schedule are vaccines that don't prevent transmission anyway, so herd immunity has nothing to do with it.
Got it. One more question about vaccines, because I know we need to wrap up soon. Here's the promise that you made to Congress when you were going through your confirmation process. You said, I will support the CDC vaccine schedule when I get in there. Isn't this a violation of your promise?
No, this is the CDC vaccine schedule, and I am supporting it.
So, but I don't think that that's what senators took you to mean, that you would go ahead and change it.
Well, of course I'm going to change it if the president asked us to look at what the European countries were doing, which have much less chronic disease than we do, and to find out what the best practices were there and to implement them.
But CDC officials who focus on immunizations say they were cut out of the process.
Well, that's not true. There are CDC scientists who contributed to the report, who read the report. Their contributions were part of the report, so CDC was part of the process of developing this report, which is based upon the best science. And again, it doesn't take anybody's vaccine away from them. Every vaccine will be insured. Every vaccine will be part of the Vaccine for Children program. They will be paid for. I promise I would not take vaccines away from people, and I've kept that promise.
Two more topics very quickly, if I can, because there's so much news. This week you halted $10 billion in federal services funding for 5 states that are run by Democrats. This is money that goes to needy families, money for child care. Why? I understand that you want to look into allegations of fraud, but why punish the poorest families while you do that?
The best way to help poor families is to end the fraud, so the money is available for them. And that's what we're doing. And the states that are affected are not affected because they're Democratic. They're affected because they refuse to cooperate with developing plans that would end the fraud. We gave them a warning. He said, show us your plan for ending the fraud and we won't cut it off. But if you won't show us a plan, a workable plan, we're going to cut it off until you do.
How long do you think it'll be cut off for?
Well, that's up to them.
Final question. Many members of your family, the Kennedy family, have spoken out against the unofficial name change of the Kennedy Center to the Trump Kennedy Center. Can you understand why they're upset about it?
Of course I understand it, but I have bigger fish to fry. If we lose any children in this country to obesity, heart disease, 77% of our kids can't qualify for the military. Saving one life is more important to me than the name on a building.
Did you get involved in that decision at all?
No.
Did you recommend that they not change the name?
No.
You don't have a problem with it personally?
Like I said, I have other focuses and other priorities, and that's making America healthy again.